Where the hell is Callum? He needs to know that there are 3 senior nurses stuck here doing nothing while up on the ward they are scrambling to cover us.
You don't need to worry about anyone else. You just need to think about yourself.
You will be fired by the end of the day. You will answer directly to Callum. Where is he?
Please just sit down.
Stop telling me what to do!
You're under stress, Scotty, and you're not seeing things clearly.
You're one to talk. You're the one who went to the psych unit. You're the crazy dyke.
Hey, it's enough.
Finally. What took you so long?
Okay, why don't you take a seat and we'll work our way through this, huh?
I want them both fired. Except her, she's on my side. Aren't you?
You endangered a patient's life. If you'd added more
The
insulin...
patient had been prescribed Act Rapid.
Which had already been given. The red label was on the infusion.
Is that true, Scotty?
Okay. I was tired. I somehow overlooked it. I'm sorry, and it will never happen again, but it hardly justifies mutiny. Try telling me you've never made a mistake. Come on.
I want you to see a doctor.
There's nothing wrong with me. I'm just tired.
Okay. We're going to go and see Sarah right now, okay?
You can special Mr. Reed, and you're in room 3. As long as you two can play nice, that is.
Well, we're all professionals here, right?
Could you make sure all my phone calls go straight to my cell phone and do the auto office thingy with the emails?
Consider it done. Have a great time.
Thank you. Ladies, just to let you know that Scotty won't be back until next week.
Has Sarah managed to pin down what's wrong with him?
Not yet, but I'm sure she will. Now, I'm going to be away tomorrow, so we need to sort out who's going to cover for Scotty.
Well, I was a charge nurse for several years in Wellington. I could step up if you needed me to.
Surely you're next in line, Maia.
Well, of course she is.
I'm happy to help.
Excellent. But let's use that experience of yours. She could fill in as charge nurse on the surgical ward.
Good call. Vasa?
Sure, no worries.
Good. All sorted then.
Okay, so room 3, and let me know if you hear anything about Scotty.
Sure.
What's up with Scotty?
He's taking some sick leave. He'll be back next week.
Is he all right?
I hope so. What are you doing here?
I remembered I need to check something with Mrs. Manda.
Mrs. Manda has gone home.
When was she discharged?
2 days ago, you gave her discharge papers.
Oh, right. My mistake. I'll tee it off then. Sorry.
No worries. How are you getting home?
Not a complete invalid.
I'm not stressing you out, but you're clearly shaky on it. Sarah's on the ward following up a patient. I'll go grab her.
No, don't. She's busy.
No, you need a thorough checkup. Hold on 1 second.
We're on the same side here. I have to make sure every staff member's up at the plate, okay?
And I have patients that need caring for. Excuse me.
Is everything all right?
Fine, thanks.
I hope you two aren't still offside about your girls.
No, we've dealt with it. Wendy's just a little stressed out because of the lockdown.
Okay, because we all need to work together. I know that I'm harping on, but this isn't the time or the place for personal issues. We're discharging Mr. Nugent, Ward 8. Did you get Mrs. West's room cleaned?
Done. I couldn't wait for the cleaners to come in, so I did it myself.
Why?
With the lockdown, it was going to take them a couple of hours to get to it, so...
No, I don't want nurses stepping outside their duties. If there's a situation, you let me know so I can get it actioned, okay? Besides, they're specifically trained for isolation cleaning.
I was careful. I did a good job.
Marks for initiative.
All the same, let them know they can go over it again so we all know it's been done properly.
It's busy and she's stressed. Don't take it personally. You did good.
Sarah, I know you're about to run off to dinner, but I got Scotty's results back.
Oh, great, thank you.
Can't see anything much wrong. Raised white cell count, but only just above the normal range. Consistent with a minor infection, but not consistent with how weird he's being.
No, and that concerns me.
Give him a call.
Yeah. I'd like to run a few more tests, maybe a lumbar puncture.
It's not a meningitis picture, though, is it?
No, but there's something definitely going on. I just don't know what. Hey, Scotty, it's Sarah here. It's about 7:30. We just got your test results back, and you have a raised white cell count, but that's pretty much it. So when you get this, give me a call, and we'll arrange a time for you to come in tomorrow. And in the meantime, try and get a good night's sleep.
Hi, and don't worry about work, you big stress merchant. Everything's fine. So sleep tight. Don't let the bed bugs bite.
There is one other thing that I can think of.
Something cerebral, like a tumour. I hope not.
Who's got a tumour?
Oh, we don't know. We're talking about Scotty.
Ah, right. But he didn't have dysphagia, though, or ataxia.
No, but if it is a bleed or a tumour, you know how fast these things can progress.
I'll give him a call later.
Do you think that we should swing by on our way there?
What about after? Well, hon, I've booked a table for 8 if you want to drink first. So.
Scotty might be dying, but oh no, Maxwell must be fed.
Exactly, your point.
Okay, we'll swing by after. Come on then.
Have a good one.
Thanks.
I've just done Mrs. Doyle's dressing.
Why? I just did it.
Well, not properly, you didn't. It fell off and I had to do it over.
The old trout probably pulled it off. She gets a bit funny about it sometimes.
Well, if she does get funny, you should have ensured the dressing was properly secured. I don't have time to clean up after my nurses.
Yeah, okay, settle down.
When it comes to patient care, I don't settle for second best. And I don't appreciate you blaming the patient for your mistake. Make sure it doesn't happen again, please.
Oh, got up her nose.
Still settling into charge position, maybe?
Found another victim, you mean?
Hypothetically, yes. Lucky I don't know. Nicole, is Mrs. Hardy prepped for theatre?
I'm just about to do it. She's last on the list.
Well, if they get ahead, they'll be screaming for her. You should know how theatre works.
I do. Look, I just finished my break. It'll get done.
It would have been better if you'd sorted her before your break. If theatre had called, it would have been us doing your work again.
I'm onto it.
Nicole's a good nurse, really.
Not when she keeps slipping up.
Well, you were maybe a little harsh.
Look, Nicole's used to her girlfriend being her boss. Now she's too laid back. And I can't have any of my nurses being laid back now, can I?
Nicole's a good nurse, really. Wait, I've said that already, haven't I?
Yes. And when she lifts her work rate and her attitude, I too will think she's a good nurse. Until then, I'll be her worst enemy.
Does it have to be a head-to-head thing?
I'm not in the job to be everyone's best friend. Okay, the priority is patient care.
Oh, great. Is there any chance that we can get another bureau nurse in? Annie in Ward 7 had to go home sick.
Without seeing me first.
Well, she was sick, so I just told her to go home. I can cover most of what needs doing, but not all, so can we call the agency?
If someone needs to go off, they see me first, okay? Well, what needs doing?
An IV to replace, a catheter put in. Mrs. Hedrum needs assistance feeding, then obs and drugs.
Well, considering 2 of your patients were discharged, I'm sure you'll cope until the night shift come on, okay?
Yeah, whatever.
Now, see, it's that kind of attitude that's not winning her any friends.